breaking news from over the weekend. The first infant is believed to have died from the coronavirus. An investigation is now underway. The medical history of the baby, who lived in Chicago, was not immediately released. The commissioner of the Chicago Department of Public Health, Dr. Allison Arwady, joins us now. Doctor, good morning. Thank you for being here.
Good morning.
It seems like we constantly have to recalibrate our sense of risk when it comes to the coronavirus. At first, it was only people in the upper bounds of age, and then it was middle-aged people as well. And now we have this tragic news about a baby there in Chicago. What more can you tell us about this infant's case?
So I can tell you it's very unusual to be seeing a case like this. So obviously we're doing a thorough investigation, working really with the family. Our hearts go out to them, the pediatrician, the medical examiner, the CDC, really wanting to make sure we're doing confirmatory testing, looking at everything that's underlying it. I spent a lot of time yesterday on the Facebook Live that I do every day here in Chicago, really putting into the context the risk that still, where we look across the world, where we look across populations, it's a tragic situation here in Chicago. We're obviously concerned about it, but by and large, the main risk does remain in the older populations, the folks with the underlying medical conditions. And what we don't want to see, we did see in Chicago people bringing in, healthy babies to emergency departments, worried about their health. That's not what we want to see. We do want to make sure that we're keeping this in perspective, even while we're doing the full investigation.
That's an important note, and it is a saving grace that so far, at least, it appears this virus does not affect children and infants, and this is an outlier case. But cases are surging there in Chicago, and we know as the virus makes its remorseless way across the country, no city, no state, no county will be spared. So as you see this surge, talk to us about the steps Chicago is taking to bend that curve down.
Yeah, absolutely. So we have a very strong Stay Home, Save Lives campaign. We've been tracking every day here. We're continuing. We're at about 2,000 cases or so in Chicago residents, about 4,500 across the state. And we are working very hard to do everything we can to keep the spread down while we prepare the healthcare system. So we've got the hotels in place for isolation. We're doing lots in our congregate settings, working with the jails, working with homeless communities, working with our long-term care facilities. We're working and even looking at surge capacity in things like McCormick Place, which is our largest convention center, not waiting till the time where we run out of capacity to try to build it. We've been working at the health department to distribute hundreds of thousands of masks just in the last few weeks, gloves, all of the other equipment that we've had on hand here, really as part of our planning for a pandemic. But we really do look to the strategic national stockpile at the federal level for even more support around things like ventilators, things like these supplies. Certainly more need still for testing capacity here. Our numbers are what they are, but we know,
Well, I just wanted to pick up on that point about working with the national stockpile. The coordination between state and federal and city officials all across the country, it seems to be marred by lapses in communication. The federal government will say they send something, the state government will say it hasn't gotten there, and then, of course, it's got to make its way to cities like yours. Can you talk to us about the communication process and the coordination going on from where you sit?
I can tell you, first of all, we have a strong city-level emergency preparedness program that has been informed over the years with good work between the states and the federal government. And so we're not waiting for support from any external source. Like I said, we're using a lot of the plans and stockpiles we have here. We've put in requests. There are pieces. Certainly, we're working closely with the state, and where we see, for example, the Army Corps of Engineers is helping to do the structural build-out at McCormick Place. We've gotten some indication that we'll receive some supplies, which is really important. We're really thankful for any ventilators in particular that we're able to be getting, because you can't make ventilators out of nothing. You need them here when you need them. But as we're thinking about what does it look like to staff up some of these, especially the external care sites, really wanting to make sure that this is part of a national framework for planning. Mm-hmm.
Dr. Allison Arwady, a veteran of outbreak fights in Liberia and overseas, and now leading the fight on the front lines in Chicago. Doctor, thank you very much for being here.